Recently, I've been excited that I've been able to find ways to unite my administrative jobs in the health system and my academic work on the research side. So I have a relatively new role as the Associate Chief Clinical Officer for surgical specialties in our medical group, which means that I'm administratively in charge of surgical specialties across a number of departments in the ways that they operate in the ambulatory setting. My research in the past has been all about how physicians and surgeons were optimizing their care for surgical patients to reduce their time in the hospital, to speed their recovery. And I was interested in how that related to changes in the way doctors were being paid, incentives to minimize time in the hospital, to minimize unnecessary care. In my new role as a health system leader, I've transitioned my research a little bit away from how doctors are managing patients and more to how hospitals are setting up their strategies of how to design care to be successful both for their patients, but also how to be successful in new financial models for how hospitals are being paid. So I recently received a grant that will allow me to study the behaviors of hospitals and health systems and understand better the kinds of strategies that will also be successful in my administrative work. So as I've slowly transitioned from being a researcher and surgeon to being an administrator and a surgeon, this has allowed me to keep up my research interests and continue to be academically motivated and academically stimulated even while I take on new leadership roles.